If you feel exhausted, feeling bloated and sick, you might be pregnant or you might just have received the positive test. This video is for you. I'm Zainab. I'm the pharmacist from PillSorted Pharmacy, and I'm going to review what are the things that happen in our body during pregnancy and explain the science behind it and how it affects our weight. Before I talk about pregnancy, I want to just quickly touch base about the menstrual cycle, because pregnancy builds up on that. Usually the menstrual cycle is a 28-day cycle. The first half of the cycle, one of our hormones rises called the estrogen, and estrogen does two important things. It prepares an egg in our ovary for release. So our ovaries have got millions of eggs in them, and every cycle an egg or two get ready to be released. That's what estrogen does. It also helps the uterus to start thickening up. Halfway in the cycle, the egg gets released out of the ovary into the fallopian tubes and drops into the uterus. By this time, progesterone hormone starts rising. What the progesterone hormone does is keeps the lining of the uterus thick, so it helps sustain that. If pregnancy doesn't happen at the end of the cycle, the hormone level dips and the lining of the uterus starts shedding, and that's what the periods are. So you start bleeding and that lining gets removed. But if pregnancy does happen, another hormone comes into act, and that's called the HCG. HCG is an interesting hormone. It rises really fast in our body, and basically it's just a signal saying, I'm pregnant, keep this pregnancy, keep it going. So with that, it puts the whole body in high alert. It also makes you very sensitive to smell, and it can bring that nausea as well. So what HCG does, it sends the signal to your whole body, and it helps the progesterone start keep the uterus lining. And the progesterone levels, instead of dipping, will start rising as well. And what they do is they protect the implantation. So they will try to protect the egg to stay put. But progesterone relaxes all of your smooth muscles as well, especially the ones that are in your digestive system. So they cause that bloating, you can't digest food that easily, it causes constipation. So those are some of the effects that you'll see. At the same time, your body starts an amazing internal construction to be able to support the baby. It starts increasing your blood volume. It starts increasing the amount of fluids that you have in your body. It starts creating a brand new organ called the placenta. Placenta's job is to make sure that the baby receives nutrition and oxygen constantly. These are the important shifts that happen at the early pregnancy in our bodies. Now I want to touch base about weight. We have covered in previous videos that high BMI can cause lower success rate in conception. So when women lose weight, there is a higher possibility of conception and becoming pregnant easier. Now, if we lose weight with the GLP treatments like Mounjaro and Wegovy, there's two important considerations to have. One is the GLP treatments slow down your digestion, and what that means is if you're taking an oral contraceptive, it might not get absorbed as good as it should. So it's really important to use a barrier method of contraception as well. The other important thing is there's not enough studies and evidence around GLP treatments while pregnant and breastfeeding. That's why it's really important to put that washout period as well. So when you're planning for pregnancy, make sure you put enough time to taper down and come off the GLP medication before pregnancy happens. If you're actively losing weight and you're not planning to become pregnant, take that contraception really seriously. What does the pregnancy weight gain mean? What are the scales actually showing you? The important thing is this time your body is not just about gaining fat. It's got a lot of different functions that are happening in it. Part of it is the baby growing itself. The other part is the placenta. The other is the amniotic fluid that surrounds the baby. Then your uterus enlarges really big as well to be able to protect the baby. Your blood volume is being increased. Your body holds much more water. All of these are to be able to support the baby and sustain the growth. That's why we don't want to restrict the nutrition or have strict diets during pregnancy, because your body needs that for all of these huge shifts that's happening. Now I want to talk about medication. If you're taking any medication, it's really important to get it reviewed, because for any condition, there's usually better options. Sometimes the dose just needs adjustment. Sometimes there are better alternatives for this period. So it's really important to get all of the medications reviewed. Now let's talk about nutrition. One of the most important things in nutrition is your blood sugar levels. We want to keep that as stable as possible. It's really important for the work of the placenta and the growth of the baby. Your body is already under a lot of pressure doing all of this internal work. When there are spikes of sugar, your placental hormones can cause more insulin resistance in your body. So that spike can lead to gestational diabetes. So that's why you're coordinating your blood sugar is really important. The best way to do that is to have regular small meals. Try to put your fiber and vegetables and protein before having something sweet. Now protein is really important, again, for the growth of the baby, for sustaining your own body. Iron as well is one of the most important supplements. Iron itself can cause some digestional issues. So for example, if you see the iron absorption is not enough, have your iron tablet with a orange juice, something that will make the absorption better. Avoid taking it close to caffeine. If it causes constipation or diarrhea, then we have a lot of different kind of iron supplements. So hopefully there will be one that can work better for you. The other thing is folic acid. Folic acid is really important for the neural tube development of the baby. Okay, so it's better to start taking it even before pregnancy, and you can carry on taking it as well during pregnancy. A couple of other practical support things as well. Be mindful of all of the things that happen during pregnancy. So nausea, constipation, bloating, and tiredness. These are the 4 important ones that from day one that you've realized you're pregnant, you want to be able to have a solution with this, because they're just going to get worse. Okay, for the nausea, make sure that you have these small consistent meals. Don't skip mint tea, ginger tea. These are really helpful. Don't go on an empty stomach. That is one of the reasons that nausea comes up, but I know that you become more picky, so it's okay to choose the right food and have a little bit more of it. And then for the constipation is really important. The bigger the baby becomes, the more pressure it will bring on your digestive system, so everything will slow down even more. But it's really important to not get constipated too much, because it can cause hemorrhoids. Hemorrhoids are really difficult to handle during pregnancy. If you're having to strain when you go to the toilet, you need to add in more of the fiber, vegetables, and moving around. Walking is really important. Fluids are really important, and fiber heavy, plus laxatives. Fruit and vegetables have got plenty of these, like flax seeds, avocado, courgette. All of these are really good. For heartburn, again, you want to go for smaller meals, consistent. And another key thing about heartburn is don't lie down after you've eaten food. Okay, again, the space is quite constricted, so make sure that you give enough space for your digestion to be able to work. And the other one is tiredness or fatigue. Again, this is an important one to think about from the day one. At the early pregnancies, you don't have any signs to show you're pregnant, but there's a lot going on in your body. If you start building in lying down breaks in the middle of the day, as many as you can fit in, this will be a really good habit that you're building for your whole pregnancy. So even a 20-minute lie down in the middle of the day will help that energy budgeting in your body to happen. So it will help with the flow of your hormones, it will help with your digestion, but most importantly, it will stop your feet becoming swollen. That will become a big issue towards the last trimesters, but at the beginning is more about your energy regulation. So give your body time to rest. Now, what do you need to look out for? The good thing is the pregnancy process in general is clear. So it takes 9 months. The doctors will start asking you about what was your last day that you had a bleeding, so that they can allocate a due date for you, and they will have regular tests and checkups, so blood tests, blood pressure tests, scans for the baby. So these are quite regulated, they're structured, so you'll be checked and looked after. But in things that you need to look out for and be mindful, if you feel any sudden pains in around your tummy area, if you start having bleeding, even if it's just a for feeding. It's better to get it checked and discussed than not, okay? In a nutshell, pregnancy is an exciting time. It affects your whole body, including your weight. We're here for you for that clinician-led safe advice. Subscribe to our channel. Thank you.